This presentation will explore the current literature available on the effect that the use of transcranial direct current stimulation has when used to treat major depressive disorder. Studies in neuroimaging have found that one of the factors contributing to depressive disorder may be hypoactivity in the left dorsolateral prefrontal cortex and hyperactivity in the right dorsolateral prefrontal cortex during a depressive disorder. Because of this imbalance within the prefrontal cortex, transcranial direct current stimulation, also known as TDCS, has been used to attempt to balance out activity through excitatory stimulation of the left dorsolateral prefrontal cortex and inhibitory stimulation of the right. This led to a reduction in depression symptoms in study participants, but it was unclear whether this effect was the result of polarization of only one side or whether both were necessary to see improvement. An analysis of studies ranging from 2013 to 2019 show that TDCS is significantly more effective at reducing depressive symptoms than a placebo, demonstrating that there is empirical evidence in support of TDCS as an effective treatment of depression, but these effects disappear when used in conjunction with other therapies. Major depressive disorder is characterized by depressed mood, loss of interest in usual activities, or loss of pleasure in usual activities, with these defining traits coming from the Diagnostic and Statistical Manual of Mental Disorders, a manual used by mental health professionals to assist in diagnosing mental health conditions in patients. The disorder is caused by deficiencies in monoamine transmitters, which limit the amount of serotonin, dopamine, and norepinephrine that the brain intakes. This deficiency in monoamine neurotransmitters is often the result of inherited neurological disorders, and increasing the level of these neurotransmitters through external means results in the alleviation of depression symptoms. Direct current stimulation is the use of a non-invasive electric brain stimulation tool to alter spontaneous brain activity and excitability through the alteration of the subthreshold of neuronal membranes. This stimulation has the ability to affect both the targeted area as well as functionally connected networks, and effects can be felt beyond the period of stimulation, known as the after effects. The primary effect during the stimulation includes the altering of the polarity of cells. The after effects are not completely understood, but many consider them to be related to synaptic plasticity. These effects include the persisting altering of the polarity of cells, with the length of the effect correlating to the duration of the treatment. Studies done on the efficacy of TDCS versus placebo in the treatment of major depressive disorder have found contradictory results, with some finding a higher efficacy of TDCS, while others found no significant difference between the two. This demonstrates an inconsistency in the results of TDCS as a treatment for major depressive disorder, making it an unproductive form of treatment. While recent studies have shown that the use of TDS is more effective in the alleviation of depression symptoms than a placebo, these are not the only two options to treat depression, as many forms of medication have been found to be effective for treating depression, especially less severe depression, which is the primary form of depression that TDCS has been effective in treating, as the more severe a patient's depression disorder is, the less effect TDCS has. Much of the research done on the effects of TDCS has been conducted on animals, and thus our understanding of why the effects achieved from this treatment have been achieved is limited. While it's believed that the reduction in depression symptoms is due to the balancing of the prefrontal cortex activation through TDCS treatment, these beliefs are purely hypothetical and lack empirical proof. The effects of TDCS treatment is also not strong enough to sustain for extended periods of time, meaning that patients would have to repeatedly return to labs to receive treatment. Analyzed studies found that TDCS effects only last for up to 4 weeks before they begin to reduce. Alternative treatments include medication, which is usually taken every day, but the ease with which it can be taken far exceeds TDCS treatment, meaning that TDCS effects are not strong enough to justify patients returning to lab sites to regularly receive treatments. Future research in this field should focus on increasing the duration of the effect of TDCS on reducing major depressive disorder symptoms, as this will provide the most benefit to patients. A treatment whose effect only lasts 4 weeks would require constant upkeep, as patients would have to continually return to labs to receive treatment. And in order to achieve results that last 4 weeks, the treatment itself would have to be quite lengthy to achieve maximum results, thus disrupting their daily lives.